So hi everybody, my name is Stephanie Parent, and my project was titled Preventing Workplace Transmission of TB, an arts-based approach with South African healthcare workers. So my practicum was done with the Global Health Research Program. My practicum supervisor is one of the co-director, Annalie Yassi, and the Global Health Research Program is a WHO collaborating center in occupational health. Occupational health means that many of our projects are concerned with the health of workers. And for this particular project, the workers are South African healthcare workers. And we are concerned with preventing the transmission of tuberculosis, which from now on I will call TB. So the background to this project, South Africa has the third highest rate of TB incidence globally. And healthcare workers have 4 times the rate of contracting TB compared to the population that they serve. Now, of course, in the healthcare facilities, there are measures to protect healthcare workers against TB in South Africa, such as infection control measures at different levels and occupational health services. However, many barriers prevent those measures from being fully effective. For example, there's a lot of stigma around TB, or people are worried that if they disclose that they have TB to the occupational health services, their confidentiality is not going to be kept. They're afraid of losing their job if they get TB, or they're just afraid of the disease itself. There may also be other barriers. So, arts-based approach. So far, educational, your regular PowerPoint session has not been very useful in empowering healthcare workers to comply with occupational health and infection control measures. Arts-based methods are the use of various art forms to both educate and engage participants. And these methods are very potent at creating dialogue and uncovering issues that were previously unnoticed. So the purpose of this project is to see whether an arts-based educational session is useful and successful at first educating healthcare workers in South Africa about those 5 points. First, am I at risk? Because many of them are in denial of being at high risk of getting TB. Whose responsibility is it? So we're trying to get across that it's the responsibility of the workplace, but also the individual, so a combination of both. How am I to be protected? How can I get diagnosed if I get TB? Because many tend to ignore early symptoms. And what must I do if I get TB? And we're trying to get across messages about compensation and sick leave and things like that. And the second objective is to document barriers that prevent healthcare workers from fully complying with occupational health and infection control measures. So the methods, we developed a 2-hour intervention. It is drama-based, and the outline of the intervention is as follows. So first, there's a physical warm-up where people roll up, down, stretch sideways, just so they get into their body. The image theater exercise, they are instructed to do a sculpture with their body, so whatever sculpture, according to one of the 5 key points that I was talking about in the previous slide. For the role play, they're instructed to do a little skit that is also pertaining to one of the 5 key points I was talking about in the previous slide. Then there's a debrief, and lastly, a content expert reiterates the 5 key terms that we're trying to get, or the 5 key points that we're trying to get across. There are 6 sessions planned. All of them are going to be video. There are 10 to 20 participants per session. And the sessions are led by a facilitator from the drama department at the University of Cape Town. All the sessions are taking place in Cape Town, and all the healthcare workers are working in Cape Town Metro. So the timeline, in October 2014 we defined the project. In November, December, we went through the many ethics approval processes and the literature review. January, February was the team formation and the intervention development. March, we did the recruitment process and the dry run. Now, the dry run is kind of a rehearsal session with colleagues just to refine the intervention before we do it with actual participants. April, May was this currently underway, the 6 sessions at Cape Town. June, July is the analysis and interpretation, and August is the dissemination. So for the recruitment, we went to different Cape Town neighborhoods to present the project. For example, we went to Greenpoint and Delft, and the reason why I picked those two examples is to show you the disparity that exists in Cape Town, where very rich first world type neighborhood exists almost beside very poor third world type neighborhoods. We will evaluate whether the intervention is successful by qualitatively analyzing the video to see if any recurrent themes emerge, such as stigma or fear, or we don't know yet. And there's a questionnaire in 2 parts. The first part asks about knowledge, attitude, and practices regarding TB. And the second part asks about feedback on the sessions. So the results today, this is the kind of table that we're using to refine the intervention every time we do it. For example, during the dry run session, the participants say they really enjoyed it. However, they felt that the exercises where they were instructed to touch each other felt very uncomfortable. So we decided to remove those exercises from the future sessions. So we did the same kind of table for the 4 other sessions. And by the way, the April 22nd session was deemed the most successful. So there's 2 remaining sessions. And those 2 sessions are going to follow the outline of the April 22nd session. The reason why it's in the PowerPoint is because I did the PowerPoint before the April 22nd session. What's most important, I think, is the results also include what participants think about TB, their view on occupational TB. For example, one of them said, I can't get TB because my house is very clean, which reflects the denial and the misinformation that exists. Another one said, if I wear a mask, people will think I have HIV, which reflects the stigma around TB. And another one said, wearing a mask feels claustrophobic, which is explaining why some people don't comply with the mask policies that are in place in many of those healthcare facilities. Okay, so this project was an interdisciplinary collaboration between arts and health sciences. It brought many strengths, but also some challenges. For example, the health practitioner wanted a very defined, reproducible intervention that would be the same for all sessions. They wanted to convey a clear educational message, and they thought that a questionnaire was a very appropriate way to evaluate the intervention, whereas the arts-based people prefer a more emerging and fluid intervention that would change with each session. They believe that arts-based method brings up transactive and experiential learning that cannot be measured with the questionnaires. So we negotiated those tensions, and they're still being negotiated kind of every time we do the intervention. Now, if this intervention is found to be successful, we are hoping to upscale it and to all of South Africa. The individual benefits would include that people sick with TB would know how to get the appropriate compensation and sick leave. And hopefully we would see improved compliance with infection control and occupational health measures. And a societal benefit would include decreased occupational TB infection and accurate occupational health assessment. That just means facilities would know actually how many people get sick with TB. So I would like to thank my supervisor, Annalie Yassi, the Cape Town group, all the participants that agreed to participate in this project, as well as their facility manager who gave them the permission. Also Catherine Worthington for wisdom throughout this term. And also Carmel, because I was I had a lot of delays because I was in South Africa and my internet wasn't working. And so she was very good at being okay with my delays. So thank you.
Thank you, Stephanie. Questions, comments? I'm going to go back here, and then I'll get to you. All right, Kix.
Thank you. That was a fantastic presentation. My question was around how an arts-based method like that, how is choice facilitated for the participants in terms of their participation? Because it can be an intimidating thing.
Yeah.
So how is that during the...
Yeah. So at the beginning of the session, the facilitator reassures people and she tells them, if there's anything that you feel uncomfortable doing, you don't have to do anything. And so far, no one has sat out. So far, they've all been, like, it's interesting, because at the beginning, you can see they're all kind of shy and they don't want to move too much. But then by the time the image theater and the role play, especially, they all become very expressive and very comfortable. And so far, no one has sat out. Yeah.
Thank you. And there was another.
Did you find any, or did you come across any cultural issues?
Oh boy, I was worried about that question.
Yeah. Sorry, I'm just super interested. Just sounds
I might
really...
need to sit down for this. No, I'm kidding. Okay. The worst cultural issues that I got were from Canadians asking me, why do you go there? We have our own problems here. So the first time I had that question, I didn't know what to say, so I just kind of mumble, whatever. And I'm still reflecting on the correct thing to say, but now, these days, what I answer, because I get that question a lot. So these days, what I answer, I'm like, well, it's a question of values. Some people, because of course the people that ask me that, they think we should deal with our own problems. So I say, some people think that we should deal with stuff and it's stop at our boundaries, but I think my value is that we are a globalizing world. I mean, we send coal to China and they get sick from it. Anyways, so we are a globalizing world, and my value is that we can all, collaborate with each other. So.
Good, one more.
Thank you. I really enjoyed hearing about your work, and I'm wondering, was there any attempt to measure as an outcome from this intervention, like an increase in team building or communication between staff?
No, there was not one of the outcomes. No, but I'm misstating because we thought about it, but we decided to really just keep it TB focused. Yeah.
I'd also like to ask a question. It just occurred to me. In what languages or language were these sessions conducted?
So one of the inclusion criteria is that those people the participant could be able to talk and understand English. However, the facilitator does speak African and Xhosa. Yeah. So sometimes there was a few words in Afrikaans and Xhosa as well. But so to analyze the video, there's going to be two people. There's going to be myself probably and a South African. So the word in Afrikaans and Xhosa are going to be able to be understood in an African context.
Great. Thank you so much, Stephanie.